Now let's take a look at the principles of child development. The periods of development are infants, birth to 12 months, toddlers, 12 to 36 months, preschoolers or kindergartners, 3 to 6 years old, and school-age children, 6 to 8 years old. There are 6 underlying principles or main beliefs that serve as a framework for the contemporary study of child development. One is the child develops as a whole. Development follows predictable patterns. Rates of development vary. Development is influenced by maturation and experience. Development proceeds from top down, cephalocaudal, center outward, proximal distal, and culture affects development. For the principle that child develops as a whole, children use their bodies and their senses to explore the world, and that's their physical development. They acquire and organize information and learn to reason, cognitive development. They are thinking, perceiving, and doing language development. They learn to relate to others and make moral choices, social development. They learn to recognize and trust their feelings and others, and that's emotional development. So as you can see, all these areas of development, called domains, are occurring at the same time. They are interconnected and they influence one another. They cannot be thought of as separately and addressed separately, and no single area is more important than another. Another principle of child development is development follows predictable patterns, and this is universally and through a continuum of development. As an example, development is sequential and cumulative. In other words, there are milestones that are achieved in a predictable sequence, and the skills from one is needed to be acquired before moving on to the next stage. For an example, if a child is learning to run, first a child would learn how to walk, and prior to that a child would learn how to crawl, and prior to that a child would learn how to lift their head and move their body. So there's predictable patterns that fall within a continuum and a sequence. And with those patterns, there's also development that varies. The rate of development varies. Development is personalized for each child, and again, it is on a continuum of development. There's a child's age in chronological age, and there's a child's stage in development. So those are approximate and they're related to each other. However, there is not just one rate of doing it. The rates are actually varied. So what we can do is understand that because of the variables, that this may be an area or typically developing children are, but we still need to make accommodations for the rates of development being different. Another principle is development is influenced by maturation and experience. Maturation is the unfolding of genetically determined potential that occurs as a child grows older. In other words, the growth and development are thought to be hereditary or be in process already when the child is born, and it proceeds according to a predetermined, orderly, and predictable pattern. In other words, it's a result from physiological maturational changes. And this is in contrast to experience, where it is actually interaction with environments, people, and things. So it is the learning experience that the child has interacting with their environment that influences development. So these two things, maturation and experience, maturation is also known as nature, where a child has inborn traits and hereditary, and the other piece is nurture, where the child has experience with the environment that actually influences the development. Another principle is development proceeds from top down and center outward. Top down is cephalocaudal, center outward is called proximal distal, and this we can see with cephalocaudal, the top down, is that you can see most clearly in infants before they learn how to crawl. First they have to learn first they develop control of their heads, and before they learn how to sit and walk and crawl. So we can see that the top down. And then the proximal distal pattern of development is the large muscles, which is nearest the center. Center of the body grow and develop and they coordinate functions before the small muscles, the hands and fingers, are coordinated. So this is another piece, top down, center outward, that universally we see in development of children. And in the last principle of child development, culture affects development. Children's development is influenced by culture in which they live and grow. Values and beliefs of each culture and family determine many of the experiences and opportunities that are provided for children, and that developmental expectations have a cultural component. So as an example, some cultures place a high value on independence and self-assertiveness. So you'll see young children in these families to be very verbal and have verbal interactions. They express their feelings and ideas more frequently and skillfully than families who use more nonverbal interaction cues or who value less of assertive interaction styles. Conversely, children whose families have taught them nonverbal communication skills may demonstrate a more sophisticated ability to observe others and be able to interpret and being able to communicate with other nonverbal cues that those who are verbal may not have that background. So in summary, principles apply to all children, and oftentimes several principles are overlapping in the same situation. As we see the child development as a whole, we see all domains that may be applied to different situations. We're going to see that too when it comes to principles. And knowing these general principles can help educators predict and plan for the 4 stages of development. Principles and to help us to interact better, plan and interact with them throughout their early childhood years. We need to know these general development as well as the research and theory about what is happening in specific ages and stages of development.